Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. October is National Breast Cancer Awareness Month, and today on Community Health Heroes, we'll be focusing on this common cancer that 1 out of every 8 women have a chance of developing in their lifetime. First, we'll be speaking with Dr. Ralph Corsetti. He's the director of the Tansey Breast Center at Ochsner Medical Center, and he'll talk about the latest advancements in breast cancer prevention and treatment options. Many who do get treated for breast cancer lose their hair during chemotherapy. But in New Orleans, there is one special place where you can fight cancer and look fabulous at the same time. We'll talk to a breast cancer survivor who did just that at FiFi Mahony's in our Community Health Heroes report. Serina Phoenix, the co-chair of the 2017 Susan G. Komen Race for the Cure, and Honorary Survivor Chairwoman, Pastor Fran will also be stopping by to tell us all about the upcoming race on Saturday, October 21st. And October is when football season really kicks into gear, which often means a lot of unhealthy snacking while watching the games. Regional Executive Chef of Centerplate, Lenny Martinsen, who prepares all the Eat Fit concession items at the Mercedes-Benz Superdome and Smoothie King Center, will be in the kitchen for our Eat Fit NOLA cooking segment. Chef Lenny and Eat Fit NOLA ambassador Emily Eickhoff will show us how to make some healthier choices and serve up a tasty chilled Asian tuna salad. So don't go away. We'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Community Health Heroes. Did you know breast cancer is the most common cancer in American women except for skin cancers? Currently, the average risk of a woman in the United States developing breast cancer sometime in her lifetime is about 12%. With us to discuss the latest in breast cancer prevention and treatment is the director of the Tansey Breast Center at Ochsner Medical Center, Dr. Ralph Corsetti. Thank you so much for joining us today, Doctor.
Thank you for having me. It's a pleasure to be here.
Thanks. First, let's talk about breast cancer. What is it exactly, and are there many different types?
Yeah, breast cancer is an abnormal cell growth that happens in normal breast tissue. So a woman has normal breast tissue that typically involutes or gets replaced with fat over time as she becomes older and goes through menopause. But that cell tissue can change, and where you can have an uncontrolled growth of those cells, and that can happen either before menopause or after menopause. And that's when we typically define cancer as an uncontrolled cell growth of typically what would be a normal cell population.
Let's talk about signs or symptoms. I mean, we all see it all the time, you know, a lot of self-examination, but what are you exactly looking for? Because there's some confusion.
Biggest thing is to do early detection through screening. So most breast cancers are painless, so there's not a sign or symptom that tips that off. So 95% of all breast malignancies are painless. You can have pain with breast cancer, but it's very uncommon. So screening comes into play, and that's what helps us find breast cancers early. So it's typically starting mammograms at the appropriate age will help us find an early breast cancer, where the majority of breast cancers now that we find are early stage, provided the patients start their screening early.
And what type of doctors do you seek out? Like, say you feel something, who do you call to get the ball rolling?
Well, at the breast center, at Ochsner, at the Tansey Breast Center, we have a breast specialty team that's consistent of breast surgeons, breast surgical oncologists, of which I am, and we have 4 on our staff, as well as nurse practitioners that specialize in breast care. And to see a breast health specialist, a breast care coordinator is probably the way to go. They'll get you into the right algorithm in terms of what your symptom is, whether you're having pain or whether you're having an abnormal mammogram or you want a second opinion on something that's abnormal and potentially may need a biopsy. We have all those algorithms available.
And let's switch gears and talk about prevention. You hear scary statistics, 1 in 8 women. Is there anything you can do to prevent the possibility of getting breast cancer?
Probably not. You can do things that can reduce your risk. The the thing with breast cancer is the vast majority is not hereditary. Only about 10% of all breast cancers are hereditary. So that means 90% are non-hereditary. So those, you can potentially do other things to reduce your risk, such as reducing alcohol consumption. There's some studies that as little as 2 drinks a day can increase the risk of getting breast cancer. Obesity is also considered a risk factor for getting breast cancer. It all has to do with increased amount of estrogen exposure that the patient would have.
I know there's some very exciting news you have us about treatment. I know there's been a lot of breakthroughs lately in genetic testing and genomic testing. Let's spend some time talking about that.
Okay, so there's a difference between genetic testing and genomic testing. So genetic testing is a patient that has a family history of breast cancer, say they have a mom or a sister, which is considered a first-degree relative. If you have a first-degree relative with a history of breast cancer, that doubles your risk of getting breast cancer. If you feel that you may have an increased risk based on your family history, we have the opportunity to have you go through genetic counseling at our breast center as well, and see if you qualify for genetic testing. If that's done, then we can give you several options, including high-risk screening, which would include MRIs of your breasts in addition to mammograms, and other options that we can discuss.
I mean, nowadays you hear about women doing proactive surgery even.
Correct, and that's one of the options as well. So you can go from very close observation, you can go to risk reduction strategies by taking an anti-hormonal agent, it's called chemoprevention, to take anti-estrogen medication, or you can go to the extent of having the breast tissue removed, which would reduce their risk about 95% of ever getting breast cancer in someone that's a high risk for getting a breast cancer. So genomics, on the other hand, that's analyzing the actual tumor cells itself. So once we diagnose a breast cancer and remove a breast cancer, we will often test their receptors. We typically check for what's called an estrogen receptor, a progesterone receptor, what we call a HER2/neu receptor. All these give us higher risks. So, for instance, a HER2 positive tumor would be treated a certain way with certain medications. A tumor that's triple negative, where all these receptors are negative, that's a very high risk tumor. That's treated a different way as well with a certain combination of chemotherapy agents.
And this is all called targeted therapy?
Targeted therapy.
So basically, you're trying to outsmart cancer, right?
You outsmart it and you attack it for what it's doing. For instance, if you have an infection and you're on an antibiotic and that antibiotic's not working, what do? We switch it to a different antibiotic. Mm-hmm. So you try to target to what specifically will kill that tumor cell. So genomics come into play a lot, where we know the high-risk tumors are going to get chemotherapy, these HER2 positive, triple negative tumors. But we have, the majority of our tumors are considered relatively low risk, where they're estrogen positive and HER2 negative. Now we can do genomics to see if those are high-risk tumors or low-risk tumors. We have certain name brand companies called Oncotype DX or Mammoprint that give us a risk assessment score. And that can help us tailor the patient's care as to whether they actually need chemotherapy or not.
It's such a blessing if you can skip the whole
avoid
chemo.
Correct, because there's a lot of side effects. So we're able to now assess some of these tumors and see if they're high risk or low risk. If they're low risk, we can just treat them usually with anti-estrogen therapy, endocrine therapy, which is a pill form of chemotherapy, but has much less side effects.
Mm-hmm. And just to finish up about treatment options, is there anything else that any of the ladies watching need to know about? Anything out there that should look for?
Well, again, if you get diagnosed with breast cancer, the standard of care is to go through a needle biopsy first. So you can get all the diagnostic information, get your receptors, get all the information you need to initiate a treatment plan, and then seek out the breast specialist. Once you've sought out the specialist, then we'll go through the whole gambit of whether we need to do surgery first or chemotherapy first, and what your therapy is going to be tailored to.
Gotcha. And if our audience wants to follow up and learn more about treatment options, is there a certain place they can go and read up about this?
Yeah, they can go to the Ochsner website, which is ochsner.org, ochsner.org, and either link onto the Tansey Breast Center or through the Cancer Center site. Or you can call us directly at our Tansey Breast Center, which is 842-6406.
Right. Well, thank you again so much for joining us today with some great news. Thank you. When we return, we'll have a Community Health Heroes report about a colorful place in the French Quarter where breast cancer survivors can fight the disease with a little humor, sass, and hair fashion flair. So don't go away. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know hair loss occurs because chemotherapy targets all rapidly dividing cells? Hair follicles are some of the fastest growing cells in the body, which means as the chemo does its job, it also destroys hair cells. Within a few weeks of starting chemo, those in treatment might lose some or all of their hair. In recognition of National Breast Cancer Awareness Month, I found a place in New Orleans that specializes in making wigs that aren't just functional, but they're pretty fabulous. It's where many women find a fanciful refuge when fighting breast cancer. Lisa Picone Love is an actress and an advertising sales manager. She's also a breast cancer survivor who found refuge at FiFi Mahony's in the French Quarter.
Losing your hair is really traumatic for a woman. And when I was battling breast cancer, a lot of people, I think they were trying to make me feel better or make it feel like it was less of a traumatic thing. Oh, your hair will grow back. It's just hair. But for a woman, your hair is something that defines your personality and who you are. And I've always had long, full hair. So going from this to bald was extremely traumatic.
Lisa is not alone. Many women who get treated for breast cancer lose their hair. FiFi Mahony's co-owner, Marcy Hesseling, said many customers come into her wig store and hair salon for that reason.
I'd say it's probably about 20%. And I know that some wig, companies only deal with people that are going through chemotherapy, but we live in New Orleans, so obviously there's a huge amount of costuming and partying that's going on here. So I'd say about 20% of our people are people that actually have to wear wigs or coming in for a hair loss situation, and most of that, yes, is due to chemotherapy.
For 20 years, FiFi Mahony's has supplied many Mardi Gras crews, fashion shows and photo shoots, and serviced eclectic clients from around the world. Wigs at FiFi's cost anywhere from $30 to $300, but Hesseling said helping those who lose their hair is priceless.
When I first started having people come in for hair loss issues, the feeling of helping someone to go to work, go through the day, to look better, to feel better about themselves was enormously rewarding. And I was very just opened my eyes up and I thought, oh, well, this is an important part of this business. Like, it is probably the most important part of this business, so we do take a lot of pride and a lot of care with people that come in for that situation.
When you're fighting breast cancer and you lose your hair, you don't look anything like yourself. The drugs made me puffy. I actually gained weight when I had cancer and didn't lose weight. I was bald. I had no eyebrows. I had no eyelashes. When I looked in the mirror, I didn't look like myself.
She's a great actress and a great singer and always so much fun. And she's been friends of all of ours at FiFi's. And for years was just getting wigs for Mardi Gras. And then all of a sudden she came in one day and was like, guess what? I have breast cancer and I'm going through chemo and I'm going to lose my hair. So, then we needed to get her something that was for real.
While FiFi's specializes in couture costume coiffures that come in every color, style, design, and theme imaginable, the store also sells a large line of wigs that look real, and some are even made out of human hair. Before, during, and after cancer, Lisa splurged on many wigs, and even though her own hair grew back after chemo, she still stops by FiFi's to add to her collection.
FiFi Mahony's, first of all, you think of it as a costume wig shop, but you can get the fun, playful, colorful wig if you want to be fun. But if you want to walk around and you have to go to work, I had to go to work when I had breast cancer. So I wanted to look like a normal person. So that's why I got, the real hair, human hair wigs that they have that are gorgeous, that look like real hair.
Hair is very important to women, and it's, it makes us feel like a woman. And so it's to be able to give that to somebody to make them feel fabulous again, to make them feel confident again, I think it's something I hadn't really experienced that type of feeling until I had worked here to do that to somebody. So it's really wonderful.
When you look in the mirror and you don't look like yourself, it really helps to put on hair that looks beautiful and not just an average wig. But their wigs here are affordable and they look gorgeous. If you come somewhere like FiFi Mahony's, they can really be there to help you choose what looks great on you, and more importantly, what makes you feel great.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please, don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Did you know evidence is growing that regular physical activity reduces breast cancer risk? The American Cancer Society recommends that adults get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity each week. And I can't think of a better way to get some exercise in October than to participate in the 2017 Susan G. Komen Race for the Cure. Joining us now are Serina Phoenix, the co-chair of the event, and Honorary Survivor Chairwoman, Pastor Fran Love. Thank you so much for joining us today.
Thank you for having us.
It's good to be here.
I want to hear all about the upcoming Susan G. Komen Race for the Cure. Tell me, when is it and where is it?
The Race for the Cure will take place Saturday, October 21st at City Park, across from Tag Gormley at the practice track.
How do you participate? I mean, do you have to train for this, or do you have to raise a ton of money, or can you just show up, or how does that work?
Oh, not at all. No, you don't. Training is not required at all. We just ask that people register, and you just show up and enjoy the festivities. We have a lot of sponsors there, and people just come out and have a great time.
So how long is this walk? Is it a walk run too? How many miles is it?
It's a run walk. We have a 1K in the morning, and then a little bit after we have a 5K.
And how many participants are you expecting? How many people signed up?
Oh, we're expecting between 8,000 and 9,000. That's our goal this year.
Wow, it's a big goal. So Serina, let's start with you. How did you get involved with all this?
I became involved. I did the race in 2009, and I just loved the spirit. I loved the energy of the race. And in the midst of that year, I also noticed that I had a lot of acquaintances, family, friends being diagnosed with breast cancer. So this was kind of my way of giving back.
Well, that's a lovely story. And Fran, tell us a little about how you got involved.
I got involved basically similar to the way Serina got involved. My church, the City of Love, we got involved because we do have a lot of survivors that are a part of our ministry, and a lot of my personal friends are. So the first year I ran the race for my friends, for people that are a part of our ministry, and as I went through the race, I was constantly reminded of the struggle that they'd been in. So it wasn't really for me initially, it was for the people I love.
But now you're the Honorary Survivor Chair.
Yeah,
so tell us a little about your story, your cancer story.
My story is one that I say today is amazing, because being considered the Honorary Chair for Susan G. Komen is such a tremendous platform that's been given to me. But a year ago, I was diagnosed with breast cancer, and I had to have a double mastectomy. The cancer was extremely aggressive, and we went from 1 lump to 2, and then the cancer began to spread. So it was somewhat frightening initially, because anytime you get the diagnosis, you have cancer, it takes the wind out of you. It took my breath away. It took the strength from my legs. But once I regained my stance, I realized that I was not going to die, but I was going to live, so that's why I'm here today, so that I can give hope and encouragement to people that are in the battle. But what I also realized was this: it wasn't just my issue. It was an issue for my family, for people that were close to me, and for people that are in this community. So, I thank Susan G. Komen for choosing me, and hopefully I can say something that'll make a difference.
Well, what do you ladies think that people take away from this race, whether they've been personally affected by cancer, or family members, or they just want to join? When people participate in this race, what do they walk away with?
Hope.
Truly, it's hope, and it's knowing that there's 8,000 people behind you, and the fact of knowing that by participating in the race, you are directly making an impact in the local community.
How much are you looking to raise during this event?
We're looking to raise $250,000 this year. That is our goal.
That's a great goal, and with so many people participating, I'm sure you'll all be close. If someone wants to get involved, where do they go to find out more information?
Sure, you can visit our website, www.komenneworleans.org, or feel free to call our office at 504-455-7310.
And Fran, if people want to hear more about your inspiring story, you mentioned you're a pastor at a church. How can people get in touch with you?
City of Love, 8601 Palmetto in Carrollton, Louisiana. You can contact me via email, franmlove@aol.com. I want to tell my story, because this is not a death sentence. You can live beyond this. You can.
Well, thank you so much both for joining us, and especially telling us about your inspirational story and all your hard work at this race. Sounds like it's going to be a really big success.
Thank you so much.
Thank you.
When we return, Centerplate's Regional Executive Chef, Lenny Martinsen, and Eat Fit NOLA Ambassador, Emily Eickhoff, will join us in the kitchen to prepare a chilled Asian's tuna salad. So stay tuned for more Community Health Heroes.
I'm Molly Kimball, registered dietitian and founder of Ochsner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
Joining us in the kitchen is the Regional Executive Chef of Centerplate, Chef Lenny Martinsen, and Eat Fit NOLA Ambassador, Emily Eickhoff. Thank you so much for coming here today.
Thank you for having us.
Well, as you know, the Saints are trying to score a lot of points on the field, but it's super easy for us to score some extra calories while we're watching them. But not today. Today we're going to discuss some healthy options.
Absolutely.
And these are things you can actually buy at the Superdome and when you watch the Saints and then across the street too when you watch the Pelicans at the Smoothie Center, right? So tell us what you're preparing today, and then we'd love to hear about everything on the table.
Well, the first thing we're going to do is I'm going to show you how we're going to make our little chilled Asian tuna salad. Really, it's something that you can actually make at home. So I know a lot of times you see stuff on TV and say, that looks great on TV. But this is something you can actually make at home, and it's a great dish. But also a chance to show some of our other courses. So the first thing I'm going to do is I'm going to turn this on and let it get hot. You can see that the pan is already getting hot. The secret when we want to pan sear tuna is you want to get it nice and smoky. So while that's going, and then all we're going to do is we're going to cook it like for less than a minute. So you can see it. And what I've done is I've taken a nice tuna steak, and you can go to your local fish market, and we'd wrap this up in just some black and white sesame, but you can season it with anything. Everything from K-Paul seasoning to salt and pepper.
Well, it looks really pretty the way
and
it
so
is
what
right
we're going to do, we're just going to drop that in. You hear that sizzle, and we're going to let that go like that. And then while that's cooking, you can see what we have here is we have our regular cabbage. It's got shredded cabbage with carrots, and then we have what we call, this is seaweed salad or wakame salad. And you can buy this in the Asian markets. It's a staple. And then we have a little mix of bamboo shoots and water chestnuts. And then I have a little bit of toasted almonds and coconuts, and that's all going to go together. But you can see how simple that is. I seared it. I'm going to turn it over. You can see how nice and golden brown that is.
Oh my God, yeah.
So we're going to let that go and do that. In the meantime, while we're doing that, I'm going to take some of this, and you're just going to mix it in real simple while that's cooking. And we're just going to mix it together and do that. Now this is one of our more popular items, and as you can see, we have a little bit of variety for everybody because I like to think that you come to the Saints game to eat food. I know that's not the case, but I like to think it is. But we have something for everybody, and what we found out in the last, everybody likes hamburgers and hot dogs, but there's so much more. We have a lot of people now that are health conscious, and they want to, going to the game is not just about, getting your favorite beverage, it's getting something healthy to eat. And that's what we've been able to team up with Ochsner for the last couple of years. So I'm going to turn this off.
Emily, tell us a little about what the chef is making in terms of like the calorie count, the nutrition value. Why would this be a really good choice?
Yes, this is an amazing choice at a football game or a basketball game because it's about 450 calories, which is a decent size amount of calories for an entree, but it's filled with a ton of protein, a ton of fiber, which is not only going to get you through halftime and the second half of the football game, it'll even get you through hours after the game. So that's why we really love all of these dishes. They're all very high in protein. There's no refined carbohydrates, everything's whole grain and things like that. So we really love it.
Now, are there a lot of Eat Fit concession items at the stadium?
There are so many.
We have them on the 100 level concourse. We have them in the club level. We have them at the 500 level. So they're all throughout the dome, and we actually have a stand called Market Fresh, which features all these items. So you're going to those particular stands to eat something healthier. Everything from fresh fruit cup to our tuna salad. This is one of our popular items. It's called our barbecue shrimp and grits. But the grits are cauliflower grits.
Oh, this taste pretty good?
Yes.
It's amazing what you can do with
cauliflower. They can't even
cauliflower.
tell the difference, really. If you have someone try them, they're going to think it's regular cauliflower or regular grits, when in reality it's grits made from cauliflowers.
Yeah, that's just one of our items. And then we have a couple of our sandwiches here. We made a couple of wraps, and you can see this is what we call our chicken Caesar wrap.
That's pretty.
Everybody likes Caesar salad, but we've made the chicken Caesar wrap with a low-fat, healthier dressing, Caesar
Now,
dressing.
This one's the most popular one,
This is
right?
our most popular. This is our buffalo chicken wrap, and this is our most popular sandwich, bar none. It doesn't even matter if it's Eat Fit NOLA or what. It doesn't. They don't care. This is a great
So
sandwich.
they all go past the pizza and the hot dogs and the hamburgers, and they eat this, right?
We're selling well over 300 of these sandwiches a game. It's unbelievable. And what it is, it's the same thing. It's the chicken, and but it's a buffalo wing sauce that we use. And we have another partner besides Ochsner, which is Swags, which gives us these healthy dressings that they make, and we blend it in with there. So it's all this partnership where we come up with our salad, like you can see right here. We have our salad here, and then we're going to put our little bit of coconut on here. And then what's really nice is you can do this at home. And right now we haven't done any salad dressing on it. You could eat this just like this because with the seaweed salad. But we have our low-fat vinaigrette dressing right here, our Asian dressing that we just put on the side, but I just wanted to see that. But again, this is where your imagination takes over. You could do this at home. And now watch what we're going to do here. We're just going to slice the tuna real simple, nice and rare, nice and chilled.
It's beautiful. And working as an Eat Fit ambassador at the Saints games, I've noticed people, they'll come up to me at the concessions and they'll say, I passed the nachos, I passed the chicken nuggets and all the bad stuff, and I was looking for a salad and you were here, and I love you for that, and thank you for doing that. So the audience is out there, and they really want these healthier options.
And then what we do is we serve it like that, and that's
that's
how we serve it to our guests. And again,
it looks gorgeous.
And it's a great option, and we've getting a lot of feedback, great feedback.
Well, along with the lines of what Emily was saying, so is this now a trend, and more people like demanding like healthier options at big sporting events?
Yes, because there's a market out there. There is a niche out there to say, we have, I can't eat what I like to eat all the time, and also, but the thing is, we're eating good.
Oh, and some Saints fans, they'll let you know. They're like, I don't think healthy when I come to a Saints game, and that's fine. But just being there for those people that do want it, it's very important.
Well, how did Centerplate hook up with you, Fidel? How did you all start your partnership?
Well, Ochsner is a sponsor of the Saints, and they've been there. And again, it's all about partnerships and working together. And then hooking up with Molly Kimball when we heard about her program throughout the city about getting local restaurants. But then now we've actually partnered with another organization, Swags, which is a local restaurant group that's given us these healthy dressings and such. So there's that synergy and there's that work together, and it's just a great community involvement because I think it's just something that. It's part of the community, and I think it's great.
It really is.
Well, I know something else that's very exciting that's going on is this raffle. Could you tell us about this guitar raffle, and what's it all about?
Yes, it's a Saints design guitar. We have 11 Saints players' signatures on there, including Drew Brees, which we're really excited about. And you can buy a raffle ticket. They're $10 each at eatfitnola.com and click on the guitar tab, and that'll be able to you'll be able to buy a ticket from there.
Are you able to track to see how that's going? I'm sure everyone wants to get a raffle ticket for that, right?
Yeah. Sales are going great, and so we're going to call the winner on December 10th outside of DTB, which is a restaurant on Oak Street. So we're really excited about that.
Well, it sounds like you have a lot of exciting things on your plate, and thank you so much, Chef. This was wonderful. I mean, this was so quick and easy. You made this look so effortless, and it looks like it belongs in a magazine. It's beautiful.
It's so beautiful.
And it's nice to know you have some healthy options when you're at the Superdome, and if you just don't want to always go for the fries, you can go for the tuna.
Absolutely.
And just want to let you know, we're going to be putting this recipe up on our website at communityhealthheroes.org. So thank you so much for joining us today, and we'll be right back with some more Community Health Heroes.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you on breast cancer prevention and treatment and healthy eating options at sporting events help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.